There was a study that you guys had just recently done, an observational study that has to do with ivermectin and mebendazole. Please tell me about that study that you guys conducted.
McCullough Foundation teamed up with a wellness company, which is now the largest vertically integrated alternative health company in the world. And we sought out to investigate why patients with cancer were taking the combination of ivermectin and mebendazole. It's their choice to do so. It's clinically appropriate, medically necessary, off-label use of the medicine. Recall that ivermectin and mebendazole are both anti-infectives, but they have anti-cancer properties. In preclinical studies with ivermectin and actually in clinical studies with mebendazole, both drugs by separate mechanisms do three things. They reduce tumor proliferation, reduce angiogenesis or blood vessel formation around the tumor, and then they cause the tumor cells to shut off, apoptosis. And so we had about 200 patients go through the study. I believe just over 120 were at the 6-month mark. They reported in on their CT scans and PET scans and how they were doing. Now, the most common cancers were prostate in a man, breast in a woman, and then lung cancer in both groups. They were mainly solid organ cancers. A third were already in remission to start with, and then the rest of them had active cancer. And so what we found is that those largely in remission stayed in remission. About a third with active cancer didn't progress, which is great news. And then 16% of patients, there was a regression. The metastasis improved. So this is great news.